'Cause I know we're gonna fight the Cause I know we're gonna fight the It takes so long. Cause I know we're gonna
All right. Yes, that is the subject of our conversation today on Wellness Wednesday. Good morning. It's good to see you. My name is Winnie Lubembe. Welcome to the show. The show is your world. No, you're not lost. We are not in a hospital. We are here.
No, you're
studio.
My name is Mikali Mary, and today being Wednesday, we are all about your health. We're here to make your life better, easier, educate you. Mimi Leo, to be honest, Winnie, Nico class.
Same.
Nico darasa.
Same. And you know, when we talk about hair and when we talk about skin, there's so much. There's so much in terms of advancements, and especially when it comes to treatments. So that is what we'll be focusing on today, showing you the latest technology that is there, especially when we're talking about hair loss and also wrinkles. I know because for wrinkles, Sisi hatraki kuzeeka.
No.
16 forever. Sisi do a young forever. Okay, so how about we learn how to especially deal with those wrinkles zile sumbua haziendi. Doesn't matter what you do, it doesn't matter ukitengeneza kuna massage ya face, do you know by the way? Therapy, you massage hivi like this alafu inakataa. Don't worry.
Umejaribu kuna mavitu unafanyanga ritualistic things at night
to try and hide the wrinkles. Listen, you need to stick around until the end of the show because today hata hatuaulizi swali. Leo tuna learn sisi wote because like Mikali said, we are in class.
We are in class. And I think it's a good subject, Winnie, because I mean skin, it's everywhere. It's the biggest organ in the body. So we need to take care of that. And I know walitoa kawimbo wakisema I am not my hair, but ikianza kupotea, you become your hair. You become very worried.
And they say hair is the glory.
It's the crown.
It's the crown. You know, and especially for us women. So ukianza kunotice kadogo inapotea hivi, you start getting worried. But all hope is not lost because there are advancements when it comes to treatment. There are several things that you can do. And what you guys saw is PRP. And we have the best people to tell us what PRP is all about. But I like the fact that hakuna chemicals or nini being introduced. Just use your own blood. Isn't that amazing? That's really cool. That's really cool. So yes, so we learn about all that in the conversation today. Tuko na machine kubwa iko hapa kando yangu. I'm like, huku sasa tunenda. Didi iko hapa. Okay, but we'll learn about all that, like we said, as we continue with the conversation. So who do we have today? Who are our guests today?
Today, this conversation is not one-sided. We're not just bringing experts to you. We are also bringing you people who've taken that journey. Yani tuko na watu hapo watatuambia mimi nimefanya, sijafika kwenye naenda, lakini kwa hii safari hapa ndipo nilipo. All right? And today we are starting in the first hour, we'll be focusing on skin. On hair. We're focusing on hair. And then in the next hour we'll be focusing on skin. So our guest today, starting from
left.
Starting on Winnie's immediate left, we have Karen Atieno, who's a clinical aesthetician. I hope I'm saying that
You don't struggle with that term. I have to say that pole.
I have struggled. It didn't look like it.
No. You got it. You did it. Hey, clinical aesthetician.
And next to Karen, we have Edwin. And I'm not so sure if I will say your second name right, but I will try. Please, Edwin, nisaidie.
Okay, my name is Edwin Onyon.
Onyon. Okay, got it. And you're a hair restoration and therapy patient, so you will be talking to you about what the journey looks like and what you've had to go through and what even got you to that position of wanting to do that. And next to Edwin, we have a certified aesthetician as well, Domiana Mwangangi. Welcome to the show.
She's not new, actually.
She's not.
To this show. At this point, tukutafutia tu room hapa nyuma. Sit down. It's so good to have you. Karibu Karibuni sana. Thank you for making the time on this Wellness Wednesday to teach our people, our audience, as far as, you know, first of all, how important it is to take care of your hair and your skin, but also kama shida imetokea, there is hope. Okay, so yeah, so who do we start? Maybe kwanza tuanze kwa esthetician. Yeah, kuna clinical na kuna certified. Tusaidieni.
And it's not just that, really. There's so many big words on today's show, right? And to breakie down hizo PRP ni nini, you know, like definitions. Tukianza na majina zenu.
Yes, but tuanze na tuanze kwanza esthetician nani? Anafanya nini? Then sister will talk about clinical and certified. Can we start with you, Karen?
Yes, so clinical esthetician. It sounds like a tongue twister, by the way. It sounds like a tongue twister. So basically what I did, I had to go to medical school first.
Okay.
I did a clinical medicine, so that's where clinical comes in.
Okay.
And then I practiced for around 4 years. Afterwards, I went and specialized in aesthetics.
Wow.
There's a difference between aesthetics and cosmetics. Those are two different things.
Okay.
Daktari. Okay.
So yeah, after the 4 years, I went and did like the aesthetics medicine.
Okay.
So that's where the clinical esthetician comes in.
Okay. Hi,
So esthetician wanafanya atatuambia bado. So tunajua daktari wa meno ni dentist.
Kwa skin ni dermatologist.
You know?
Sasa esthetician anafanya.
Daktari wa cosmetic ni esthetician.
Okay.
That's the most simplest way
to put it.
Exactly.
Okay. All right. Thanks, Karen. Dovia, the aesthetic. We've known each other for a very long time. Yani this one, she's gone to Dubai. She's gone to Spain. Ameenda kusoma.
Domiana.
So the technology keep asking for you to go back to school.
Yes.
And as we knew each other, long time I used to be a nail tech and a makeup artist. I think 10 years ago.
Oh my days. So
many years. So at times I went back to school to do aesthetic medicine. So aesthetic medicine, you get to prescribe products, but now I cannot prescribe medicine. And there are some treatment injectables. As of now, I cannot do, but doctor would do.
Okay.
But we work the same, hand in hand. I will need her when I do a consultation and I feel like this is treatment is for a doc, I give it to her.
Okay.
And sometimes she feels like this client need prescription of products, paramedical products, which are skincare products, but they are more into medicine side. Then she will give me that client, refer me.
Yeah.
Then that's why we work together.
Okay. What influenced the switch, the change? What need was there for you, probably even in the world that you were in, to be like, let's go cosmetic?
Cosmetics.
Yeah.
The need was there because a while back, I just used to do nails, makeup, but as I would do makeup, I would find out people had many issues of skin.
Yes.
Eczema, and some people would ask me questions of scalp conditions. I didn't know. And at some point, also got really bad skin, acne. And I was in the same industry, but I couldn't get any treatment. Then with all this, then I got a chance to go back to school, just to go and learn what can I do to my clients who keep asking me questions about skin. And that's I went passionately to do skin aesthetic medicine. And passionately, I love it. And that's why I also keep going back to school now to learn more.
I mean, look at your skin.
Hey,
Daviana, give us all the secrets. Give us all the secrets. Give us all the secrets.
So you say when you're doing treatments and you're preaching about skin, you have to look. You have to preach the word first with your skin. And because I suffer acne, and at some point, 2016, I had really bad acne. I learned how to take care of my skin, and I learned that client would come and ask me, "What happened? You treat your skin, I come back." So from that time, I learned that I need to take care of my skin first for my patients or clients to see what my skin looks like. Then they believe what I tell them, and they will follow.
Absolutely.
Okay, we'll talk more about skin on the second hour of the conversation, but let's talk about hair. Okay, and we have Edwin here today. So you've done is it just PRP or?
Yes,
You've done PRP, right? For how long now?
almost, this is the third time.
Oh, interesting.
Yes.
Let's go back. Let's go way back. Because most of the time it's us women who have issues. Oh, hairline. Oh, it's you when I'm breastfeeding. My hair falls out. Oh, so you hormones here and there.
Yeah.
But yeah, let's go back to when did you start noticing, you know, that kidogo my hair kuna kitu.
Yes,
Yeah.
okay. When I celebrated my 29th birthday,
Okay.
I noticed that almost checking on my head, it was almost 50%.
Okay.
I'd lost all my hair.
Oh, wow.
So
Okay.
at that time, when I was now eating 32, it was now worse, almost going to an extent, almost 75%.
Okay.
So at that point, I became so much worried, and my self-esteem was also very low because by the time I could gather with my age mates,
Yeah.
then I'm like this mzee para.
Oh, yeah.
Yes. So
Yeah.
at that point, where I became so much interested on how I could get a solution on how I can get my hair back.
Okay.
Because I was just assuming what would happen if I hit 45 or 50.
Yeah. Then you lose all of it.
Yes.
Yeah.
So at that point, I had to do my own personal research.
Okay.
Then is when I came across this humble team. Yeah.
Fantastic. Okay, so are there specific areas maybe on the head that you were noticing either receding or the hair is completely not there?
Yeah, I think later in the course of the show will be shown how the situation was.
Okay.
But most this area was had lost almost everything in this area. Plus,
Okay.
I had 2 spots. People used to call them torch.
Oh no.
Yes.
People who are
Yes.
Walikuwa naita torch.
Yes. So
Yeah.
it was somehow like my identity.
Okay.
Yeah. So at that point, it was an headache because I had to go to the barber almost twice in a week,
Yeah.
so that I maintain it.
Okay.
Bold.
Yes, yes, so that you cannot notice that
That
I'm
there's
almost
something going
100%
Yeah.
out of air.
Oh,
Okay.
interesting.
Yeah.
Okay. All right. I'd want to know because I read somewhere they said men and women lose hair differently. So I don't know whether that's true, and even the patterns. But again, there's so many other conditions that you know are concerned when it comes to hair.
Yeah,
So do you want to take us through? Because for us, women, it's like, hey, hairline, you die. Hey, it is good. It's
Protective hairstyles is what we are doing.
Okay, that's actually true.
Yeah.
Okay.
The same way, men and women, actually the rate of which gents' hair growth, it's way faster as compared to ours.
Oh.
Yes. Okay, the way he said,
Most of them have like really
okay, like for a dude, he can go to like a barber, the way he said, after every 2 weeks.
Yeah. Yes.
And then for us to notice, assuming like you've plaited your hair, for you to notice there's a growth, labda like a 1 month, a 1 month period,
yes,
you see? So
yes.
there's a difference between hair growth between
Men
ladies,
and
men
women.
and women, right? Same way, there's a difference between hair, lose it, between men and women.
All
Yeah.
right.
Mind you, us, literally from our emotions, the way we carry ourselves, literally our whole life is based on hormones.
Yeah,
Right.
those ones.
So,
Those ones.
so the same hormones can actually mess us
Okay.
up, you see?
All right.
There's a certain type of hormone, when it becomes to excess, you lose hair around this area, right? Pregnancy makes you lose hair.
Yep.
So we've skipped us, like you've already gone through the pregnancy journey, given birth. Breastfeeding can make you lose hair.
That's true.
Okay. On top of that, add stress, everyday stress of
Yeah.
that baby and the life and everything can make you lose hair. So
Yeah.
There's a lot.
there's a lot
I
going
mean,
on.
as a woman, it's like your child is female. She comes with this. Hair loss. But then again, I think, Domiana, then what kind of hair loss are we looking at that requires this kind of treatment? Ingine tungoje tu tumalize ku breastfeed, and then nywele tu irudi, ama do we run every time something happens, nimevurutwa nywele Kenyatta Market, dakika mbili, nimekimbia kwa Domiana. What kind of, what determines the kind that needs the treatments that you offer?
Okay, so we have two types of hair loss. There's alopecia. So we have two types of alopecia, scarring alopecia and non-scarring alopecia. So first, when you come to our clinic, we need to figure it out. Which type of alopecia do you have? Right? Okay. So one will have to, that's how we use the hair scalp analysis to see whether you have hair follicles. With your hair highs, you will find that you will see Edwin with a scarring, but we are not sure whether it's scarring alopecia or non-scarring alopecia. Non-scarring is very shiny, right? But the scarring also, it's also shiny. But then the scalp analysis, when we use it, we'll see it later, it will show inside the layers of the skin, we'll see hair follicles. So that tells us this is a non-scarring alopecia. And that's how we know they are qualified to do a PRP treatment. If they are scarring alopecia, then it's even on the, when we check with the scalp analysis, there is no hair follicles. We can't see nothing. So that way we will know they are not qualified to do PRP. That's how now we suggest we send them to a surgeon to go do hair implants now, because nothing can be done
on that.
Yes. So the first stage is to know which type of alopecia do you have, and of course we'll do consultation just to hear history of how do you do, when did it start, what products we've used, what happens for you to start, what happened for you to experience hair loss. And then from that information, we'll figure it out which type of treatment to be given or which type of alopecia. Then from there, we'll guide from the information you give us. And that's why we'll always recommend a consultation first before doing anything.
Don't do your own things.
I think that's true because, I mean, we know...
what happened?
Stop laughing.
Okay.
It's serious. So you haven't gone to have a consultation done. And then there are these people selling magutas.
Well,
you know, there are all kinds of things like apply here, sleep like this, bonnet yako lazima ikuwe silk, like, you know. And maybe there really isn't anything you can do or Domiana at that point. You need to go for a hair transplant.
I promise you, a lot of people have actually invested a lot of money into some of these products and not knowing that, listen, it doesn't matter. The hair might never grow back ever again, you know, so get a consultation. That's what we're talking about. Can we also talk about traction? Because most of us, you know, like we said, tunaenda tunavuta ikazwe vizuri. Ndio
Actually, where we start, which hairstyle do you do? Who does your hairstyle? Who does your different styles you like? So from there, we'll need to know the client's personality. What do you like doing? So which braids do you do? How long do you do it? Who does it? And how do they do it? From the explanation of how you do it, who does it, definitely we'll pick that this person could have cost you. So then we'll advise you more on which safest hairstyle and who can do. In the process of doing this, we were forced to start looking for hair braiders who does very good job, so we can recommend, because not all the stylists who can give the styles we are looking for, and they are not up to date of which treatments should take care of this client's hair. So that Domiana would struggle with our treatment. So we have to, we work together, we partner with hairstylists who braid and who understands now the today's technology and today's struggles. They are not traditional hairstylists. So again,
3 months, but you're doing voice to your hair.
I'm not so sure, but I think this was the question really that was on your tongue. It's like, what hairstyles should we be avoiding?
You should, you should avoid
and even for the men too.
Twist. Umesema tusishike zile za Wamasai wanafanya hivi.
And unafanya hivi twist. Because you're pulling you're damaging your hair follicle. Right? Twist. And number 2, excessive chemical of palming on your hair. Yes, so you have to go to a professional who use good quality products, and also they will do also a scalp analysis to know which type of product should I use to this client who has very thin hair.
All right.
So also you have to research or know very well, who should I go to when it comes to retouching my hair or palming my hair or doing this new treatment.
Okay.
Because someone has to go and analyze your type of hair.
Okay.
Not just going and then putting you on a just chemical just anyhow.
Just because.
Because things have changed. Our lifestyle now have changed also the way our hair would be in 2 years. So you have to look for a specialist who will treat your hair.
Okay.
For your hair growth to continue healthy, to be healthy.
You know what I have had, weave and wigs.
Again,
And
I will go
wigs.
back to wigs.
You know? Yeah.
Me too,
Can
I
we
love
talk
wigs.
that? Can
But
we
at
talk
some
about it after
point-
the break? Because I do not want to rush through like Zilla's head to the break. Yeah.
Yes.
Can we talk about it? So wigs,
Wigs, and also depends on the type of wigs. The
Yes.
wigs that we always put glue. The glue that they apply under, then they fix it for the edges to be perfectly done. That kind of wig is terrible. It messes up your skin, your scalp, your everything.
Good morning.
Like we have enough clients that we struggle.
Yeah.
So we go slowly. Like we have these wigs that they're glueless. We have to look for supplier who will supply for them because they have no
360.
clue.
I like it.
Yes.
Like it's
So
not
we
just
have-
unidirectional.
Yes,
It takes care of everything.
Yes.
Okay.
So also when you do the wigs every single day with the glue, the hair will not work the way it's supposed to work.
It's supposed to, 'cause it's
the
supposed
hair
to come
follicles,
out,
they are
not-
closed.
Yeah.
Yes. And then also the friction on where the cap. You see, on the wig there's a cap round.
Yeah.
So and it's a bit harder.
It
You
is.
feel it.
And then
So when you
guara
fix it
side.
and you do a glue,
Yeah.
and then by the time you are done, they tie something too tight.
Yes.
You are stressing your skin.
And also for the men who wear
For the men,
caps all
again,
the time.
Also who wear
right?
caps all the
Yeah.
time. Again,
Yes.
it will make the hair loss become a bit more worse.
Yeah.
And also there are men who also keep retouching or texturizing their hair.
Their hair.
And most of the time they want it every other weekend. And their barbers, yes, their
Yeah.
barbers don't advise or they don't know.
Yeah.
They do the texturizing and also every week they will do color. There's one color that it really messes
Their
gents' hair. The one that is in sachet, that is looks like a shampoo. It's called
Something.
that one. That one is terrible. It burns. It burns. Actually, when you do a texturizer and you do that shampoo in a sachet, you will feel a burning sensation. So what is it doing to your scalp? Messing up your scalp.
Kwanza Domiana, you know, so both of us together salon when we're palming our hair, both gents and ladies, unanyamaza paka usikie unachoma hapo unasema
hapo
basi
imeiva.
imeiva. Wacha tuende break Domiana. When we come back, because I want us to delve deeper into that, because this is a mistake that almost everybody does. Okay, we cannot tegeza nywele. Hey, let's go to the break. Then when we come back, we'll also get to understand how this beautiful machine over here, how it works, and we'll see it in action. Well, all that is coming up after the break. Do stay with us. The show is Your World. All right, welcome back. Like we promised on the second hour, we will show you things in action. You know, tukiongea tu hivi, we're like,
what do you mean? What are you saying?
What are you saying? You know? But we're going to see how, because Domiana said it's important to, yes, go for consultation, alafu watafanya analysis, of your scalp, just to see, your scalp and the health of your scalp before, putting you on a certain treatment. So that is what we want to see now. But he's been on the knee before. No.
Yes.
So you did the first analysis?
Yes, he did the first analysis.
Okay.
So that's how we discovered he had a non-scarring alopecia.
Okay.
Yes.
All right. We have some pictures we'll show as we continue. But so after the first analysis, then Gundua that he has non-scarring alopecia. Okay. So which one is this? I don't know if you can see Domiana, but yes,
so
you can see from that
side. So that is a
side.
non-scarring alopecia.
Okay.
Yes, it is bald, but also when you see through the scalp analysis, we'll see now is hair follicles.
Okay.
Yes. We'll be able to see the hair follicles, and that is what guides us on to that he qualifies to be done PRP.
Okay.
If he didn't have hair follicles, then we'll say we are sorry, but now you have to do a hair transplant.
Hair transplant.
Yes.
Okay.
And sometimes the hair follicles are too weak. That's when they're too tiny and too weak. That's when we will tell you you need like 6 to 12 sessions. And we'll tell you it will take longer.
Longer.
For him, we did only 3 sessions and we were able to see great
improvement.
improvement
that's
because
really good.
he came earlier when the condition was not really bad.
Okay.
But someone who had this kind of alopecia and then they stay for long,
Yes.
they will come when the condition is worse, it will take longer. Yes.
Okay.
So now it varies the time we will take for you to see your regrowth, depending on how long you had the condition.
Okay.
Yeah.
Okay. All right. Karen, what are we doing now? Because I see you have a gun somewhere. Okay, not like Ganian Dushwa,
But kuna kitu inakaa bunduki
Not
for
a gun.
sure. Yeah.
Actually, we've moved from using, you see, like these kind of needles.
Yeah.
Yeah.
Ooh,
We
yeah,
like with the syringes and everything. So
Yes.
try to imagine me holding like, it's actually not this one, there's another huge one. Me holding it on your head and pricking it. You'll definitely get scared.
Yeah,
Yes.
not fun. Not fun. Yeah.
This one is a form of new, improvised, technologized.
Oh,
Okay.
Okay.
It's actually the modern way of doing the PRP.
Okay.
So with this one, I'll have, when you come to the facility, I'll take your blood sample, right? The blood sample, I put it in a percutaneous tube. Like the tubes on a hanga damu,
that one.
those ones, yes. So I'll put it there, then centrifuge it.
Okay.
Normally from biology, secondary,
Yes.
3 types of blood cells.
Yes.
The red
Yes.
blood cells, white blood cells, and the platelets, right?
Yeah.
Red blood cells, basically oxygen, carrying oxygen, right? White blood cells, they're the fighters of
Yes.
the body. Now platelets, kuna hii shule tulifunzwa, like you were taught, they help in clotting.
Yes.
But they do have growth factors in it. So these growth factors is what we are targeting.
All right.
Okay.
Now, when I take his blood and put it in a percutaneous tube, and once I centrifuge it, it will have more concentration of those growth factors as compared to the free-running blood. in the body.
Muneka kwa machine inazungusha very fast.
Ina
Then
separate.
ina separate.
Yes.
Okay.
So you see, like that separated plasma
Yes.
has 3 to 5 more growth factors as compared to the normal one flowing. It's concentrated, right? Okay. So if I take that concentrated plasma, it's actually the liquid part of the blood. I inject on the area, affected area. What we'll do, definitely the area will have more concentration of that plasma, platelets, as compared to the rest of the body. So that one will actually activate the hair follicles to start growing hair.
Okay.
Okay.
And then one thing you have to understand, it's a journey.
Yeah.
I got a question. I got a question. Is it painful? Do I need to get numb? Do I need to go under? Like, what is the procedure like for somebody who's never really gone through it, or probably is caring about this for the first time? That get injections. Blood already shatoka. What is the process like in terms of like pain levels?
So the TBT, the olden
Yes.
needle method, right?
Yes.
That was slightly painful, but what we had to do, we had to apply a numbing cream at least to get comfortable during the whole process, right? But when it comes to this one, it's painless.
Oh.
It's a mesogun. It's painless.
Hiya. Okay. Mesogun. Okay, what?
Okay.
Yeah. Okay.
So that's painless.
It's painless.
Okay.
Okay, with this one, there's no need of me applying a numbing cream. So like, it's not, you actually won't see the needles coming. And then it's way quicker. Because you see, like, it's syringes, like this is the syringe.
All of those.
So tiny.
Okay.
Yeah.
They're so tiny. So when it comes to this one, they're actually 9.
Okay.
You see, like, once I, okay, let me put it.
Okay, you do the thing. Okay. All right. As you do that, Domiande, get to now. Camera yako ni gani? The men who like putting on your hats zao na kupama. I know you talked about it earlier.
Yes,
but what exactly does it do? Because they're like Sydney hat. Tunavana tutatoa jioni. Kwani ina contribute aje to hair loss?
So basically, if you keep doing your hats, it also closes your head, so your skin is not breathing the way it's supposed to. And also the friction, where you place the hat, there's a friction happening, and you keep moving it. That friction is what will affect the hair follicle. And in good time, it will now start making the hair loss or falling off the hair. And let's say you've done the texturizing, you do color, those are two chemicals applying, and then you on top of that you do the cap, then the friction and what happened previously, then all that will make your hair loss start falling off. Yes.
Salim, hi. Salim is our camera person. Studio Corner hats. Attack. Personal
Right
attack
now.
to Salim.
Yes. Again, also, what do they use at home
Yeah.
Okay, imetengenezwa kwa barber shop vizuri, but ukifika nyumbani unatumia kipanga soap, unatumia you don't use proper
mpaka arudi tena kwa baba ndio
lazima ende apatiwe a good shampoo that you're supposed to use as you continue with your hair treatment.
Yeah.
Okay.
Or maybe normally if you just cut your hair, you need to use good shampoo for your type of your hair. We have different type of hair.
Types,
coarse
yes.
hair.
Yeah.
Yes.
Okay.
4C, the coarse hair. You cannot use the same shampoo as someone with fine hair. So you need to know from your barber. And then again, you need to know, is my barber well informed about different types of shampoos, different types of hair types, and which should I use, and also hair oils that you use.
Yeah. Okay.
If it's a man, you start this journey of cutting your hair, doing color, doing texturizing, you need to have hair food that will take care of also the scalp. Every 3 weeks we get a new skin. The cycle of skin goes after 3 weeks. So when you get a new skin, the top layer, the epidermis is just dead, supposed to be off. That's why we say dandruff, but it's just
flaking.
It's just dead skin. You're supposed to wash with a good shampoo to take off the dead skin.
Okay.
Interesting.
And those are the kind of education we educate Edwin.
Yeah. So he's a happy man. He's a happy man.
Karen, gynecoloaded.
Hey.
Okay.
So basically, this is how it's supposed to look like.
Okay.
So the needles are here.
Yes.
So what I'll do, this syringe will be filled with his platelets plasma.
Yes.
You see? So we'll be filled with it. So there's a way this machine is set in a way that it will actually administer uniform amount of the platelets on entire body.
We're not doing guesswork here.
No, we're not.
Yes, that's good.
We actually set the dose,
Yes.
and then this part we'll actually remove and then kinda. Sorry.
Well, you get the medal.
So we place it on his scalp.
Okay.
So what the machine will do, will actually sanction that portion and then it may keep into contact with this this gun, and then inject the serum. So this will assure these platelets won't go to any skin layer I don't want it to go.
Okay.
So technology.
A lot of science
really
it's
neat.
minimally non-invasive.
Yes.
As compared to injecting
Injecting directly.
And traditionally that is what has been
Yes,
happening.
totally.
Because of technology, then no painful
And it's
minimally invasive.
That's a good
and it's
thing.
safe.
Okay.
And it's safe as well.
Yes, and it's also quicker compared
Yeah.
to inject.
Single. I was about to say that.
Yes,
The trauma.
The trauma comes with injection.
The injection,
This
yeah,
one
moja
it
moja.
doesn't have like a panic of, gosh, I'm going to get injected.
Yeah.
Okay.
Right.
And if you have, like, say, for example, when he came in with 75% of his, his hair
falling
gone,
off, yeah.
Yes.
When we're doing that particular treatment, Karen, do we do the whole part the first session, or do we start in bits and pieces? Tumefanya Edwin nisamehe touch one, kuna touch two later, like do we do that? Ama umekuja, it's the whole time. When you come again, we do the whole thing again.
We do it as a whole.
Okay.
Okay.
Remember, when it comes to like hair regeneration, regeneration procedure,
Yes.
we go with how your body works.
Okay.
Because assuming nimekudunga leo, right?
Yeah.
And then I tell you to come next week, I do another patch. Remember, your body is not like on stasis mode.
Yeah. Okay.
It's still like the hair follicles that I've worked on, they're still producing the hair.
Yeah. Okay.
So if we do like in patches, you'll find by the end of the month, there's one area you'll have a lot of hairs compared to
To the other.
so
Okay,
we do
good.
it as a whole.
All
Plus,
right.
it's so traumatizing. Like, try to imagine I've told you to come like next week, I inject you again.
Yeah.
The whole process.
How do we space
Not
out
fun.
this visits?
Not fun.
We like every 3 weeks. 3
Okay.
weeks, because every 3 weeks we get new inch of hair. Every 3 weeks we get new inch of nails.
Yeah.
And every 3 weeks, that's why you feel like I need to go back to salon to wash my hair.
Yeah.
Because something has happened within 3 weeks.
3 weeks.
And that's how we recommend you come after every 3 weeks when the hair has regenerated, so also we can show you the progress. But basically on the first 2 sessions, there's nothing visible we can see. So we just manage you on, please, let's keep up, let's go, continue using. There are some sprays we'll give you and supplements, so just to combine with what you are going to do.
Now, we have people who have suffered burns, right? And again, depending on the level or on the degree of the burn, there are people who might want to see if there's a possibility that the hair would grow back.
Yes.
Yeah, I don't know whether this treatment would help.
Okay, for this treatment, we'll say no.
Okay.
Because the hair follicles are already messed up.
Okay.
Depending, yes. Again, we'll have to go back to the skin analysis.
Yeah.
We see how bad the burning went down, on how deep the scarring is.
Yeah.
From the analysis is when we'll tell whether we'll help you or now you have to go to a surgeon to do something on your scalp.
Okay.
So
Are we
kusema
able to
kweli
see-
ni
yeah.
scalp analysis.
Fantastic. Are we able to see, like, from the
Yes, yes, yes,
analysis,
we are
can we
able to
see
see
how
scalp.
the progress?
Yes, yes,
because
yes.
Edwin had a smile too, you know, he's a happy man. How long has he been on treatment?
We've done 3 sessions.
Oh,
so
okay,
basically we would say there's a month it got lost. We looked for him. Of course, the first session, you see, expectation from different patients are
different.
so high sometimes. And when you do the first session, maybe you're expecting to see like my ball or my torches.
Let me
will
tell
be
you,
covered. But it's a lie.
Yeah.
The first session, you see nothing.
Yeah.
So we kept encouraging and telling me, you know what, just come, we do the second session, we'll see.
Yeah.
Then he came back. So it was a span of like 5 to 6 months, but it's supposed to be 3 months. But because of that break, it took us like 6 months.
A bit longer.
Now. Yes.
Yeah, but I mean, he came, look, Akwapaki smile.
And that smile, Karen, what
Yes.
can we see? And based on what you saw on the first visit or the first session and now, what is it that you can tell us?
Actually, when it comes to like consultation, you have to like to check with your bare eyes first before going to the machine.
Okay.
Now, Edwin, before we did like the first session on him, actually this whole area didn't have even an inch of an hair.
What?
Bold, shiny.
Like shiny. It's like the shininess he has here.
See what we have on the screen?
Yeah.
Like, he has hair.
He has
Literally.
it, but not fully formed.
Yeah.
Yeah, just a minute. So there's some area has a lot of hair, and then there's some it's kind of patchy.
Okay.
So obviously it won't grow uniformly.
Yes.
Some will like respond to the medication fast. The other ones not. That's why I'm saying it's a journey.
Okay.
So for Edwin, it's like this honky not difference between this area and this area. You see, you wouldn't at all.
Okay.
Yeah. So and then after 2 months, that's when we started noticing baby hair.
Oh, okay.
Definitely when the hair grows, it won't be like as strong and firm like the rest.
Yeah.
So it will start like a baby hair like, and then as you continue with the procedure, that's when it will become strong and become uniform with the rest of the hair.
The rest of the hair.
Yeah.
Okay. All right. So what is it that you can tell us? Umeona la bare eyes kuna tunywele can we see the
Pachi, pachi.
Kuna baby hair.
Actually, it's so
from
soft.
the monitor.
Yeah.
So,
I'll actually do an area with less hair with naked eyes.
Okay.
But on the machine, you can notice that there's some tiny slender hair popping up.
Okay.
Is it visible?
Yeah, okay, so
Tunaangalia
yes,
huko.
our camera will try and zoom towards it to see if it's possible on the machine. I don't know if that's possible, that we can zoom in just to see what's happening on the screen. But yeah.
So actually, the hair that I'm seeing here is like the normal hair we have on our skin, like the rest of our body. It's literally same way. Tiny, weak, fragile. That's how they usually come first.
Yeah.
So that's what I'm seeing here. And then there's some areas, his hair follicles are intact. They're popping hair, but the hairs are still tiny. So
There we have it on the screen.
it's visible.
Wow, that's like how many times magnified?
So tiny.
Yeah.
You see? So this is an area that hasn't caught up with the rest of the other part. And then there's this part that has really responded well.
Ooh, yes.
Okay.
You can actually tell the difference.
Yes.
So don't not as strong
look at
as
that. Yeah.
the other side, but the hair is still there.
Yes.
You see? So another thing, something you won't see with your bare eyes. I don't know if it's there. So there are some areas. Actually, I'm not sure if you'll be okay. There's some areas without hair, but they still catch up.
Yeah. Takes time.
And then the shininess he used to have, the one that we couldn't differentiate. It's not there anymore.
Yeah.
So, and then on the torches Edwin was talking about,
Yes.
now this area didn't have any, even like hair at all.
At all.
No,
It was
it's
so shiny.
It was super
bald.
Look at
now
that.
you can see we have hair.
Okay.
Yes.
Okay.
So even though they're scarcely, like they grow in scarcely mode,
Yeah.
with time they'll just catch up and then he'll have the bulkiness like the rest of the head.
Okay.
So this thing works.
Can we see the part where there's full on hair?
Yeah,
and
where
what
there
it
weren't
looks like,
any
yes.
problems with the hair so that we see the difference. Ooh!
Oh, okay.
Hey, okay, Sawa.
Okay. Okay, now
It's
we see.
cool, it's dense, it's, yeah.
Yeah.
The scalp there is clean. When
Yeah.
someone
Clean.
is, they have dead skin, they also see.
You do? This is dehydrated skin. You couldn't
You
imagine.
can see like really dead skin.
Yeah.
And we also advise what to do.
Oh,
we have
okay.
a treatment, it's called hydra scalping,
Yes.
a cleaning of the scalp. That's also we advise, we clean, like we do like something like bathing, we remove the dead skin.
Yeah.
Yeah.
So that the treatment to work properly with the mesogan,
Yeah.
the scalp has to be super clean.
Oh, interesting.
Yes. So
Okay.
at first, if someone has really dead skin and a lot of dead skin piled, we first do one treatment that is not invasive to clean up the,
Just clean the scalp.
scalp.
Yeah.
And then now we use the mesogan.
Okay.
On a clean
So
skin.
ideally, since day one you're consulting na tukaanza with the mesogan,
Yes.
okay, when do you expect to see full hair? Is it 2 years, 3 years?
Like
6
full, like
months?
what you've seen where there is a lot of hair.
Yes.
Okay,
That
one will
imekuwa uniform,
vary.
that someone wouldn't
That
notice
one will
that.
vary
Yeah.
on how you will take your diet seriously. Now we go back. Because when we inject, we do a magic.
Yeah.
The rest is to you. It's
Okay.
on you. You have to go improve your diet, because even on the rich platelets that we're getting from your blood, it could be very weak and it could be very good depending on what you're eating. So we go back to lifestyle. What are you eating?
Yeah.
Are
Yeah.
you taking enough of water, vegetables? Are you making your blood very rich?
Yeah.
So also what, like the baby, is it getting enough nutrients for it to grow?
To grow,
So
okay.
again, we go back to lifestyle, diet.
Interesting.
Do you
Yeah.
drink? What activities do you, how is your diet like? Right? So we insist on diet again.
Okay.
I remember we have one lady, she's a pastor, she was our first actually model. Her, she doesn't drink, and when we gave her full instruction, we have a video somewhere.
Okay.
She followed to the left.
Yeah.
Completely.
Yeah.
And her hair growth went so very fast. And that is what we keep showing off.
Oh,
It's like
that's interesting.
if you
Because
do
she
this.
followed.
Yeah.
If you
Yeah,
do this.
okay.
So again, it depends on how you're doing your lifestyle for your regrowth to happen.
Alright.
I can
the
pay this
fact
much
that-
money for
Yes.
the
Yeah.
And then your
PRP
lifestyle is-
consultation, consultation and medication and supplements. But then if you go back to your lifestyle, not eating nice,
Well,
drinking a lot,
yeah.
not taking care of yourself personally, the hair regrowth will take longer, or it won't happen.
Okay.
Yes, so it depends on you. Us will give you 30%.
Yeah.
For you, you have to do 70.
70%.
And
That's a
70
lot.
is from
that's a
diet,
lot.
Diet, lifestyle.
hairstyles. You do your supplement.
I mean, if I'm gonna go through this
Yes.
mesogan thingy is.
You want 70% of the nothing.
I will do it. I will do what it takes. I don't know if we're going on a
We're
break.
going on a break in like
right now.
1.5 minutes. Yeah.
Okay,
Yeah.
good. Quickly, Doniana, maybe is there certain people with certain probably conditions that
Yes.
probably this is not for them?
Yeah.
Yes.
Okay.
We have contraindication of people who will not recommend this treatment. One, if they are on thinning medication, thinning blood
Yeah.
medication,
Yes.
we will not recommend
blood
this treatment.
thinners, no.
Yes,
No.
no.
Yeah.
If you have other chronic condition like skin cancer or any type of cancer,
Yeah.
then we will not recommend PRP. We just give you supplements, or we'll now send you to a specialist or a doctor to just continue with different options they might have.
Okay.
But if you have those conditions, then we would not recommend. Because sometimes she has to take vitals, and at the stage of consultation, she will tell you, you're not for this.
You're
or
not for this.
Yeah.
Okay. Any risks associated with PRP?
If you do proper consultation,
Yeah.
then there's no risk. The
okay.
risk
That's
which
good.
you feel it's mild irritation when we are doing the mesocan, but in 2 hours the downtime is like 2 hours, 3 hours we go back to work.
Okay.
Ah.
So I can come in the morning,
Yeah, you can
and
come
then
in the
you show
morning.
up. You know?
To cover your world.
I know, yeah. You're like,
I would have a wig.
okay.
Oh wait, that's the other thing. So
Yes.
if I'm going through this process, I have to bear my head out.
So that you don't
can do
disrupt
it.
her.
Winnie, you'll be on leave.
Cynthia,
Yeah.
you'll be on leave. Yeah, bye. See you after 2 months. Okay. All right. So as we close this session, what is it that you want someone to walk out of, the conversation with as far as the treatment? Because I know there's so many other treatments when it comes to hair loss. You've talked about hair transplant.
Yes.
Are you planning to do hair transplant anytime soon, or but you're still in the works?
Me, I am okay as far as I'm concerned. I had actually hair loss.
Oh, you did?
Yes, I did. I will show some pictures. My hair was going back because of wigs.
Yeah.
That's why I changed my hairstyle.
Okay.
But now because my hair regrowth has happened so well, so I don't need to go back to...
Okay.
Yes.
But as skin sore, are you planning to have nice hair
Skin
transplant?
soul aesthetics.
Yes.
Technology keeps pushing us. You never know. In 2 years, we'll have
never know.
transplant.
Okay.
Inshallah.
Good.
Inshallah.
Good.
Inshallah. Yeah.
Transplant.
I see. All right,
yes.
Karen, anything that you have to tell our audience as far as PRP is concerned?
Well,
Yes, and some of the questions that really they might have.
Okay, so one, this is the most safest form of therapy you can do. Because I'm literally using your blood. There's no way you'll react with your blood.
Yeah.
Okay? All you have to do is just be patient, follow my instructions, and you're good.
Hapo ndio tunakoseanga.
Daktari amesema.
Hapo ndio tunakosea. Yeah.
All right, and Edwin, thank you so much for coming as well, and allowing us to understand more as far as PRP and the treatment that is concerned. But these guys are not going anywhere, okay?
No.
When we come back, from break, we'll be talking about those annoying wrinkles.
Yeah, man.
Hey, those ones, and what are the options that are available for us to deal with all wrinkles, but really also just talk more about our skin and what we need to take care of our skin, because like we said, it's the largest organ in the body. So that is coming up on this other side of the break. Just stay with us. But ukiwa na swali, okay, feel free, by all means, give us a call, use our WhatsApp number 0112500400 and all our social media handles, okay? Ask all your questions and Domiana's team is here to answer them, okay? So we'll see you on the other side. All right, welcome back. So we are, second, I was about to say last minute before we say goodbye.
Where?
We are in the second hour of the conversation, that is Your World. And today, like we said, we are focusing on hair and skin health.
Yes.
So we did hair in the first part. But kama bado uko na swali ya hair, feel free to also send them away. Kuna mtu on Facebook amesema mtoto 4 years.
Mtoto wa 4 years mwenye nywele haimei. What do we do? What do we apply? So I think that's something that Domiana and Dr. Karen can help us with.
As we continue.
Yes.
Okay. Yeah. So we'll focus on skin now. Now, tuko na mtu anaitwa kama mtu hapa.
I know, right?
You know, I saw the first days, I was like, these guys are playing a trick on me. So we can't use like anakuja hapa kama patient and yet, you know?
Oh my God. Joining Dr. Karen and Domiana is Mary Wikali.
AKA your namesake.
My namesake.
This is so weird. Like, in what world do you ever find someone who has exact names? The last name you're different.
We're different.
Lakini tunaweza research, ujue kuna nini. It's so good to see you. Unakaa vizuri.
Thank you.
Nyinyi ni watu wa skin. Angalia glowing. Ati hakuna sijui nini. But your skin was not always like this.
Yes.
Hebu tuambie kuliendaje, what happened?
I had acne back in 2019.
Okay.
And because of baby, I had gotten a baby. And then after that, and then is when I realized my skin was bad. I needed to do something.
Okay.
So Skin Sol helped me.
Okay.
Treated my skin from zero to now where I am.
Yeah.
And now I started seeing also fine lines, wide pores.
Okay.
And also laugh lines. Okay. Then I also started anti-aging treatments because my acne is gone.
I mean, listen, acne where? Acne where? Where?
I had acne.
Yeah.
Really? Very bad acne.
On which side of your face exactly? Both
sides.
Or just one?
Yes. Both sides, yes.
And this happened after baby.
Yes.
Like before that you were fine. Baby came, acne came, and acne did not leave.
Yes.
Acne was like, I'm here to
Like, surely. Okay.
Yes, I was totally confused because my teenagehood, I've never gotten acne. So skin cell helped me. I went all through treatments.
Yeah.
Then my acne is gone.
I mean, you know, when you get your skin, I'm like,
it looks clear.
you don't have any foundation on your skin.
No.
Nothing.
Brows and lipstick. I have nothing.
Ladies, it's possible to go makeup free, foundation free, and still look amazing. Because look at her skin.
I see.
It's beautiful.
Thank you.
It's very, very beautiful.
Thank
You look
you.
very beautiful. So before we even talk about the treatments that you went through, and the machine is still here with us, analysis. So, Domiana, can we understand the different types of acne that are there? I know we had a conversation on this theme a few months ago, right here on the show.
Yes.
But yes, just to remind us of the different types of acne and the causes, so that even as you're treating, we know you're treating.
Where does it come from?
Yeah.
What
Okay,
does it
so
look
we have
like?
different types of acne. Number one, we have hormonal acne, which, like Dr. said, we are made of hormones, and especially more to women. So when your hormones are triggered, then you will find that you will get a breakout that we'll call it hormonal acne. Okay. So again, when you're doing consultation, we have to have a conversation so that we understand what type of acne do you have. There's teenage acne. That one will tell definitely because of age. Age. So when they come, they tell us, that's why we'll keep asking, how old are you? And most of the time, our clients, sometimes they get pissed off
when you ask the age, like, wait, women, we never reveal our age.
Because you see, when you tell me your age, I'm able to tell what could be happening, what could be the causes in regards to your age.
All right.
Because sometimes now teenagers have become too big. You cannot really tell whether they are teenage or where they are at. So when you tell me your age and your teenage, then definitely I will figure out this is a teenage acne.
Okay.
So I'll know what exactly to do. If you're lady and you say you're mono acne, you had a baby, we'll ask such questions. Actually, we ask, how many kids do you have? Okay. Because we also want to know, have you had kids? Maybe it could be hormonal acne happened for your skin to behave this way. And again, that's why we would ask, how many kids do you have, or are you pregnant? Because of hormone. So we have hormonal acne as well. Like her, she had really bad. Like we've worked with her journey of 2 years. For acne, she had hormonal, and then it changed to cystic acne. Cystic acne will change on how the topical skin looks like. The inflammation, when it goes worse, pass. If you've not cleaned properly, you're not taking medication, you could get just hormonal acne. But because you've not gone to take treatment, then it could be from hormonal acne to cystic acne, because there's no treatment happening. And then it becomes big cystic, like the big breakouts. The sebum is so much on the skin. So it goes to cystic acne. Then now comes dog. And when we have a esthetician, I have a patient who have cystic acne, then I don't continue giving treatments. I will recommend a dermatologist, not even her.
Not even Karen.
We have also a skin soil aesthetics. We have a dermatologist who also takes care of that kind of acne. Because at that stage, you need to take medication. As estheticians, we cannot prescribe medication. And that's why now we send the patient to dermatologist. So derma will give them medication, and there's some point derma will give us back to continue cleaning the cystic acne. And that's why now we work in a chain of a derma, aesthetic dog, and now esthetician.
And for men, do we have like...
Yes, we have folliculitis acne.
For what?
Folliculitis acne. That happens to men because of...
4.
Yes, that's number 4. Folliculitis acne happens a lot on men and women also who have beards. Yes. So it affects because of the hair follicles when the hair grows going ingrown. So then also there's that type of acne. We have so many men actually that we've treated and we are ongoing. So also with folliculitis acne, we have to first educate them on how they should shave their hair. And also it figures a point where we also communicate with the barber on how they're supposed to do their hair, how many times in a week, so that it can help us on the treatment. So also there's that folliculitis acne.
I like
because
the
I've
fact
seen,
that it's like a whole chain of
chain. Yeah, like we're not doing this in isolation.
Yeah. Yes.
Because I've seen people who now, gentlemen who would rather grow out the beard instead of cutting it, because when they cut it,
then gives the folliculitis. So they choose the route of
choose like let me just grow the beard, let me clean it.
Yes.
And all
and
of
with
that.
the beard, we've got client also has the bacterial infection on the beard.
Oh Lord.
Like you get like scaling.
What does that look like?
It looks like some I would explain like some bumps. Skin scaling, like layman's language, mashilingi. And they have some small parts inside the mashilingi thing. So it affects also it comes with now beards. Again, we educate our patients on how, if you're growing your beard, then this is how you're supposed to take care of your beards.
All right.
And what if you get this infection, you see a derma to give you medication.
Yes.
Okay.
Wow.
Yeah. Yeah.
Let me tell you, we're learning today. We're learning.
We said we are in school.
Today to go class. We're like, and then
and I love that the hair and the skin, they're very intertwined when it comes to how you take care and the causes of the things that will affect our skin and hair.
Definitely.
Because I'm sure when we go back to how we are eating, how we are exercising, what we are drinking, it is all bundled up together. But then there's when you have acne or when you have a situation with your skin, but then there's also the cosmetic bit of things where I have lifelines. When I have makeup on, nipatie dakika mbili za kukaa na Winnie makeup room. By the time I show up on the show, I have lines. I have lines.
Yes.
Imejichora. And sometimes it can get annoying. And I don't know if when you talk about cosmetology and when it comes to some of those things, is that what happens as well? Can I come to you with that?
Yes, you can come to me. But we have cosmetics, just creams that you'll apply with collagen, hyaluronic acid, and then we wait for long for the laugh line to go. But no, the sophisticated woman, they want like quicker results.
Can I wake up tomorrow?
Yes,
you know?
And that's how now we've moved from just normal facials to now skin boosters, whereby they're injectables. So we use the mesogun to inject. Peptides are good for anti-aging and plumbing. Peptides, it's
Really, if you laugh at me one more time.
Peptide it's an ingredient for anti-aging. That is in form of a booster. A booster, we have it, we'll show you. We put in the gun, and then we inject on your laugh line. That way, in 2 sessions, you're able to see results.
And then forever and ever.
No. You have to maintain everything, even your hair. When you do your hair, you have to go back to salon after 2 years.
And it's gone. Sign me up.
So you see, we've done facials, we've done hydrofacial, you've done all this, but then it's not giving results when it comes to fine lines, because fine lines are deep. The skin has really gone deep. Then you have to make the skin plump. So what do? We now inject. And that's why we have the aesthetic doc to inject.
Karen, before we talk about the injection and the gun, but you said gun zuri, painless.
Yes.
Okay, good stuff.
Painless.
So I mean, aging, it's a natural process. At some point, we'll all age, our skin will sag, and we'll get the
Unless
wrinkles.
you're Kris Jenner.
She
has a new face.
She has a new face. A whole new face. But there are things that we do to sort of like accelerate that process of, the wrinkles and, the sagging of the skin and all this. What is this that we do? That tunajiletea, tuna age skin yetu before before time. Tunasaidia process ya kuharibu ngozi. What is it that we do, not knowing?
Number one, the most basic one. What you eat is what you are. Ever heard of that? So, what we eat, right? Because majority of the supplements you're given outside there, if you started taking them early, I'm pretty sure, yes, we would age, but not at a faster pace, right? So, your diet is supposed to be more of veggies and fruits, right? So another thing, how you take care of your skin. I'm pretty sure that someone has said that who hasn't never even done a facial. We wake up, Vaseline, out.
Go.
Right?
Yeah.
Go.
So basically, I was one of those people.
You're one of those people.
Yeah, I was one of those people for the longest time. Yeah.
So I was one of those people until I entered the aesthetics field. You see?
Okay.
So basically, if you don't take care of your skin, definitely by the time you reach late 30s, you look 40s in a way.
Nilikuwa nasema hapa let me clarify.
Okay.
I know I said it's 60 something years old. Lies. I went back. It's 40 something. More like 48, 46. That's what we're up on your tuko.
And that's what we're
it's
saying.
It's not good.
It's
not good. I want to look younger.
We age our skin without knowing that we are aging our skin.
Yeah.
Right?
Yeah.
And I wonder, since I'm not Mikali, so what would you say, like even pre-baby, what would you say your routine, your lifestyle was? Did you take care of your skin? Did you have like this routine?
Given full kit. Cleanser, moisturizer, sunscreen, serums and all that. Okay. So I had to start the skincare morning routine, night routine.
Yeah.
Till today, I still do.
The when I put on this routine, because there's it's not one and the same.
We have two different routines.
Okay.
So number one, when we go on the skin analysis, we'll see skin concerns.
Okay.
You have, let's say, for example, I'll give an example of her. By then, she had very bad acne, she had hyperpigmentation, and she had some fine lines and wrinkles. So first, we treated acne. So I gave her products for acne. Right? And with acne, in the morning you use a cleanser which has salicylic or the brands I will recommend to her. But it has some active ingredients that they will take care of the active acne ongoing. So I would give her a cleanser which has salicylic. I will give her a toner for soothing because then she had inflamed acne. So I'll give her a soothing toner. Then after that, I will give her a soothing cream after the toner. And then after that, I will recommend a sunscreen, definitely, to protect the skin. So that would be the very simplest routine, morning basic routine.
That anyone can adopt?
Then anyone can adopt. And the most, if you cannot afford the 4 products, then you can just use the cleanser and the sunscreen. But now the sunscreen has to be a moisturizer. Yes. If the economy is really bad, then you use cleanser and sunscreen. Those are the most important products you would work with.
There's so many new terminologies over time. Girls we are using and we are buying over the counter. In retinol, salicylic, niacinamide, hyaluronic. Kuna maviro tu huku inakani kama tuko kwa class ya chemistry.
And then also because everybody is using it, we all go buy and use.
And definitely when you use on your skin, it's not supposed to be used this kind of products. The products are quite good, they're okay, but they're not good at that point for your skin type or your skin condition. And you see, most of the time we'll just watch online and I will keep thinking my skin is like yours.
I mean, Domiana is glowing, so I'm just like, Domiana anatumia nini? I'm busy zooming on that video.
So when you're showing videos, kindly don't just copy and paste someone's products. You need to go to an expert. They listen to your experience, what you're using currently. They check your skin and we're able to start from somewhere. Because most of the time when clients come, they will give you all the products they have bought online. You just want to scream. They're too much for the skin. You just need minimal products and don't think of the niacinamide, hyaluronic. This is too much. You're giving your skin, and we treat skin barrier that caused by overusing of actives. That is what actually we treat most. Most of the clients when they come, what we start treating is the skin barrier caused by themselves using over excessive of actives. They went to this, they went online, they have like set off. So number one, they have glycolic, they have all this. So you don't need to use so many products and so many active ingredients for you to get my skin. We just use minimal products and to give your skin time. I can do the facials, I can inject, whatever it is. But there's that circle natural of your skin needs to pause. You wait now for the skin to regenerate itself. So meaning we have to give it time.
I like that.
And
So-
you use 2 products.
Yeah.
Pause.
Yeah.
Then let's
Don't
wait.
have-
Right?
Then
Then come back.
Yeah.
Let's see how progressive your skin is.
Yeah.
Let's now add a moisturizer. Pole pole. And most of the time, we give samples. Most of the
Haraka
time
faster.
when you come to Skin Soul Aesthetic, first we'll give you samples because we just want to take time before we give you like 10 products.
Yeah.
So we monitor, we need to learn your skin. In 3 days, how is your skin behaving? Then is it getting better? Is it getting worse? Come back after 2 weeks, we check again.
Yeah.
Then now these products are working for you. Then let's start with 2 slowly.
So
then we see.
Domiana, hey, you know, now I'm concerned. I'm like, because we're told, as a woman, you need this and this and this.
If your shelf doesn't look like it needs to look active,
you know, that's a problem. But here you're saying, listen, no, you don't need all those.
You don't
things.
need all those.
Yeah.
You need someone to guide you.
Okay.
You see, 10 years ago, I would use this moisturizer, but now it doesn't work for me anymore.
Yeah.
But you see, some of us, we've used this moisturizer for ages, but it's not helping me. And you've bought others adding because you don't want to leave this one.
Yeah.
So that's why you need someone to guide you.
On the
Yes, like when we were treating her, the first 2 months we used this acne range of products. By the 3rd month, the skin needs are changed to normal skin and scarring.
yes.
So
you
the
can't
product
still
we
use those
tweak.
ones.
Yes, we
Yeah.
can't use the acne products. No, we change to now what your skin needs as of now.
So based on what Domiana is saying, because this is maybe concern level, short. So you said acne is one of the common conditions that you see and you treat daily.
Yes.
And then the barriers,
Skin barrier,
right?
sensitivity, redness,
Yeah.
and also post-bleaching condition. It's crazy.
we are bleaching a lot, eh?
Lot.
Oh God.
And it's so, you see someone come, you remove makeup, you're like, yes,
Oh my days,
it's
what's
bad.
happening? Yeah.
I have this one patient, she used bleaching creams over 15 years. Now she was old. She was brought to the clinic by the daughter, who is a doctor.
Yeah.
And when we removed the makeup, we were so shocked because the cheeks are black, the neck is just my color.
Yeah.
Because of the bleaching creams.
bleaching creams.
So the post condition comes later after 20 years. That's when it's bad. You can't continue. You can't. So you need to get a solution.
Yeah.
And
Is there a
it's too
solution?
expensive. Yes. They have, it's too expensive. It takes longer.
Nata una muda. Kama nilianza
Hakuna
tu.
muda. Hakuna muda.
Hakuna
When you
muda.
see the pictures, you just. But the post-bleaching conditions are actually the ones we are treating most.
Yeah.
Until now, we are like, what
What is happening?
Yes, what is happening?
Yeah.
What are the solutions?
I think we
How
need to
can
have a
we
conversation
reverse?
on
Need to,
bleaching,
because
really.
kuna saizi kuna bleaching mwitu and then kuna bleaching sasa ingine
Yes.
inaka sasa ni ya mabombe
and then you know-
hadi
And then
Ni ya
also
kuoga.
the whole thing about skin whitening,
Yes.
skin brightening,
And
skin
skin
bleaching. Like it's just a lot.
Yes, it's a lot, but
Yeah.
this one came from just skin brightening.
Yeah.
You see, when you're young,
Yeah.
your skin is even chocolate nice.
Yes.
And then as you age,
Yeah.
your hyperpigmentation,
Yeah.
not choosing
Kicks
of
in.
skincare,
Yeah.
life happens, stress levels goes shoot,
Yeah.
and so your skin will change at some point.
Okay.
So you would love to get your original color of your skin.
Yeah. Yes.
And that is what we call skin brightening. And that is what basically was meant to brighten your skin, even your skin out.
Not to bleach.
Not to get 3 shades of colors.
Yeah. We don't want that. Okay, we need to go on a break. When we come back, then we want to understand also a bit on hyperpigmentation and how big of a problem that is. Because I know, it came to you at some point, told me, hyperpigmentation. Yeah. So we'll get to understand that and also see, right?
Skin analysis,
the
we'll do
analysis
it, then
and
now
how
we
it
can
works,
able
and
to
then,
see.
right?
Okay.
All right. But if you have any question for Domiana, for Karen, and for Mwikali, not Mwikali, this Mwikali, ask me. Also ask her. Send all your questions either on our WhatsApp number 0112 500 400. Use our digital platforms, that is at NTV Kenya, and give us a call. We're live, okay? But we'll answer all your questions after the break. There's so many good things to come on the other side, so stay with us. See you. All right. Good. Let's say good morning. Welcome back. We are officially in the last few minutes of the show. The one I was talking about in the first.
Yes, when we came back after that, when we were getting into the second hour. Yeah.
And it's all about hair and skin today, and we tackled hair on the first hour of the show. But now tunaongea about skin, and we've talked about a lot of things that we do wrong.
Oh yeah.
We as a people, and not just women, even men too.
Even men. But then I think with this we are learning. Sometimes we think too much is what we need, but then it doesn't matter what you do. Too small, too little. If you've not done that analysis, you don't know what your skin needs, what it requires, where it's at, so that you can pick up from there. So tuache self-medication, jameni. Bleaching tumesema hiyo ina need another 2 hours.
Hey, Aki, we definitely do. 2 hours of just understanding bleaching, the whole brightening, whitening, bleaching, you know, all those things. We just need a separate show on that. But now you see Karen ako tayari, anataka kutuambia maneno. Karen, what are we looking at?
So still same machine, different purpose. Okay. So with this one, actually, this machine will tell us a lot about your skin.
Okay.
We have two types of imaging. There's one that we call shallow detection. It actually checks the superficial part of your skin, the epidermis. Okay. And then you have deep detection. Now it checks the dermis. Now, if the dermis has issues, maybe you'll just have to be patient with the treatment.
Okay.
Right? Okay. So what we usually do, we place your skin here. Your face, not skin.
Okay.
You place your face there. There's different kind of lights that we'll use to actually get the images that we want, both superficial and deep.
Okay.
So for now, Mary, I'll just do the micro detection. At least I do like microscopic view of her skin using this. The same machine I used on the hair. It has like a lot of work, a lot of purpose.
Multi-purpose.
We love it. Love it.
Okay.
So as much as she has the glow, her skin looks healthy.
Oh my goodness, yes.
Like uniform? Yes. You know, literally in a check goals. So what you see with the naked eyes can be so much different with what we see in the machine.
I mean, I'm
machine didn't detect the secret that we did not.
So you might see like she has a uniform color on her skin, but once we enter her inside this machine, you might find that superficially her color is uniform, but she has deep kind of pigmentation.
Okay.
So I'll just do an example with this one. Check here. So
this checks the dermis.
It checks the dermis, the condition of the skin.
Okay.
So like there's an example over here. You'll find like the areas where the hairs are popping, they kind of inflamed.
Oh, Is it the dark spots?
The dark, yes. So wherever the hair is popping, there's a slight inflammation around that area. So with such a skin, she's actually prone to acne. Yes. And then remember, she had history
of acne. Yes.
So she's acne prone.
Yes.
That is.
So it's not shocking even for the client to be like, I can see acne depth because I have lived it.
Yeah.
Okay.
So, and then just to check around here. She has fine lines. If I don't know if the wrinkles, it's fine lines, not wrinkles, can be visible on the screen, but she has some lines. So those are the fine lines. And then up close, you'll find like her skin is not really uniform as we see with the naked eyes. There's some part that she's slightly darker, other parts she's lighter.
Na hiyo umesema ni hiyo deep ulisema inaitwa nini?
The dermis, the deep detection.
What you're doing now is
this one is just dermoscope.
Okay.
I'm actually like microscopic view of one area of the skin. With this, once we put your face inside the machine, it will show like the general face.
Okay. This checks deeper.
And this one can differentiate, like we can check on the chest, and then we check on the forehead.
On the forehead,
and then you're able to see the different color discoloration.
What?
That's how you're able to tell your forehead is much darker than your decollete or your neck. And then that's how we tell now you have hyperpigmentation. Yes.
Because
you
when you look like this, I wouldn't say she has hyperpigmentation from just eyes.
When you check on the chest, our skin is lighter. And this is now our color. So we first check on the chest, the decollete or the neck. And then we go on the forehead. You can check on the decollete, then we can see. There you can see the color.
Yes.
Yeah, and also
You can see, and the texture.
yes,
the texture
it's
is way
different.
better.
Different, yes.
Yes, the texture is different, the color is different. So we will term this is a good part of skin or the color that she should have.
And also, so this should be the texture on
Yes,
her face.
this should be the texture. So when you go on the face, we see a bit of bumpiness. We can go to the head. To the forehead, you find that there's a bit of bumpiness on the face. Number one, those are the signs of fine lines. Fine lines, they won't come like the way you're waiting for them to come.
One day I wake up Nazili.
No. Fine lines, that's how we tell. And the texture of skin now here, she has a bit of open pores.
Okay.
The texture is not as smooth as what we have on the neck or the colate.
Yeah.
So we want to
you can
smoothen
clearly
our
see
skin.
Yes, I can see
Yes,
that.
you can see the difference. So that one gives me a reason why I should give her like skin boosters. So that we can boost the skin and the fine lines to get the smoothness. Because the skin boosters as active ingredient that will give us now the peptide we were talking about, allurolic we are talking about. They smoothen, they improve the skin texture.
So Domiana, what you're saying is it's possible for my face to look like here.
Yes, it's possible, and that's why the confusion comes with the bleaching and brightening.
Yes.
You know what I was told some time back? That after you sunburn and the hyperpigmentation, all those things, there's nothing we can do. We just manage.
No.
Yeah, that's what I was told. And I was like, goodbye, my youth.
No, definitely no. And that's why aesthetics treatments are here. And that's why we are
that's
here.
very
And that's why we have different solutions.
Oh, my
different skin,
days.
people with skin different conditions. Someone with eczema, they have really bad hyperpigmentation. Not like yours. But still they have a solution to resurface the skin texture because of the recurring of eczema. And there's topical creams, there are treatments that will give progressively your skin will improve. So it
progressively,
is,
people.
It's not
progressively.
True that, yes, progressively.
Not casual.
Yes.
Not casual.
Not tomorrow. But I'd like to find out from Mary. Sounds weird. What kind of probably treatments have you have you tried? Have you taken? Because you talked about anti-aging. So what exactly is that, and what have you done? Are you still in the process of getting that?
I've been done microneedling.
Microneedling.
Also CO2 laser for resurfacing the skin. And now I'm doing this treatment currently.
Sasa kuna mtu ana swali hapa from YouTube live. Anaitwa Elizabeth Andambi. Anasema, hi, I like the program on hair and skin health. Supposing you are on high blood pressure medication, does that medication cause hair loss? And if it does, what should you do?
Okay, so as long as your hypertension is being managed, by being manageable is that you consistently take your medication, and then you go for like frequent checkups to check on the level of your blood pressure. Once like everything lies within it will never be a normal line, but closer to the normal line, then we can do the medication on you. The PRP treatment, and it will work. But once you go, again, when it comes to us, is instructions, follow this, follow that. As long as you follow it to the letter, then everything will go smoothly. The hair will grow back. But once you like, go back to your old and ways, not taking medication, not doing checkup, back to like hair loss. It won't work.
And then another one here. How do you treat a sensitive, oily, and acne-prone skin? So only 3 parts. Sensitive, oily, and acne-prone.
So we start with the sensitivity, and that is what we are calling skin barrier.
All right.
So we manage with the treatment we have. We have machines to calm down the skin. So that one will have to come like weekly or 2 weeks to manage the sensitivity and the skin barrier. And there are some products that comes with that. So in the process, we'll treat sensitivity and acne at the same time. Because when you're treating the sensitivity, then you have a bit of congestion. We'll have to open up your skin, clean up with the acne, but not painful. We have now, technology has helped us so much that we have gadgets that will clean up your skin with no pain at all. So currently we'll treat the sensitivity and acne.
All right.
Then in good time now we will move from the sensitivity to acne scars. So it goes changing. sensitivity acne, acne scars, and then hyperpigmentation, and then later now maintenance.
Yeah. So it's a journey, because
it's a journey,
it really is a journey. Yeah. But then the thing with us, we are a microwave generation. What we want is, I need it here and now. And really, we just wait and see if your skin will ever come back or not. But then it's good to know that there's something that can be done about it, especially because we show up like this. We show up like this. The first thing I'll do is see you and your face and what it looks like.
There was a question about what about a baby with no hair? Sasa ni mtoto.
Baby with no hair. Number one, we will, for aestheticians, we can handle that. We'll send to doc and dermatologist. So that one, doc.
Doc, Doc, what do we do?
When it comes to kids, you have to understand one of the causes of hair loss is genetics, is genes. See, like you'll find in a certain family, just like mama kisema, like my hair started growing when I was 2 years. Your sister's hair started growing when you're these years. So when it comes to kids, you just have to be patient, because there's no way I'll go inject a kid, remove his blood, and what. You just have to be patient with the child. And then if you notice like the hair loss is associated with other things, that is his or her milestone is not okay, you rather go to the pediatrician. Once the pediatrician reaches a point, says like it's okay, you can do like, okay, for kids we can't do the PRP. So if the pediatrician sends the kid our way, we'll give the kid something topical to apply. But first, pediatrician, and then after the pediatrician, when it comes to skin sol, I'll first send you to the dermatologist. After the dermatologist, now me. After all these people have given me a go-ahead to do something.
That's
right. There's so many things that we've talked about, especially with skin, and we do a lot of self-prescription. We follow what influencers say, do, and we take that as, Bible truth, which is a lie. Clearly, when you look at some of the things that we are doing out here and some of the perceptions we have when it comes to, taking care of your skin, probably going the cosmetic way, what are some of those things that you tuna misunderstand kabisa? We assume we know, we do not know, and you just look at us thinking, please kuja tu nikuambie, come. Wacha kuongea, come, and I will hold your hand as I tell you this. What are some of those things?
Number one is to just this active ingredients, they say niacinamide, retinol, because I'm at this age and I want, my skin is oily, and you're not pretty sure because you saw someone saying you just want to go in and dip, and you have so many products on your closet.
Pharmacy.
So it's not about so many of them. It's not about where you buy. Totally no. It's about who guided you.
To buy that.
See online, people applying sunscreen on the 2 hands, then apply.
That's not how it's supposed to be. It's like, no. In my language, you'd say
no, you can't. That's a lot of sunscreen. Number 2. Yes, because when you apply all of it, you'll get cast. And cast, it's very important to take care of your skin. You see, we run away from the cast on sunscreen. And the cast is what actually protects us from the UV rays. If you keep using sunscreen without cast, then you're not helping your skin.
So you need to use
this is just a Pandora's box.
In half sunscreen, just a pea size, and you apply it on your cheek area where when the sun raises directly on your forehead and mostly on your cheeks, and then you spread. But the moment you use 2 lines and you apply, that's a lot. Number one, it will be very expensive.
That's true. You have to buy a lot of sunscreen.
Like,
to be honest, I actually don't.
It's expensive.
Do the 2 fingers.
But when you're watching online, they're applying. I'm like, this is crazy. This is too expensive. I'm feeling for my clients because our sunscreen as Skin Sol, it's about 7,800. If you apply that sunscreen, in 2 months you come back. Then will you afford 14,000 in this economy? It's not. So you just use a minimal.
I feel encouraged.
A pea size. And reapply after 2 hours if you don't have makeup. If your skin is too delicate or you need extra application of your sunscreen.
But
the most important is this sunscreen that us cast is the best one because it covers you from free radicals, dirt, and then now the raisins.
Na mlisema hata kama hatutoki nje.
Hata kama hatutoki nje. Even this light, hata kukinyesha, the light that we are seated on also will come direct to your skin. So we still need sunscreen. And when you use sunscreen, doesn't mean you won't get any skin concern or hyperpigmentation. Still you will get. So what else are you doing?
Okay.
You come for treatments.
Kuna mtu ana swali hapa. Sony on Facebook. Anauliza, what are fine lines?
Fine lines. You say when we age, our collagen makes our skin
plump, and you know,
so it makes the skin plump. When you're a small little baby, you have chubby cheeks because you're young, and collagen that makes our skin is fuller and everything else. Because of lifestyle and aging, our collagen goes down. And we'll find that our skin now starts aging, and when it starts aging, we start folding, like forming creases. So those are the creases, is what we call them fine lines. When your skin has lost collagen or elasticity, so stretchiness, it's gone, finished. So it forms now the fine lines. Okay. So what we do, we improve the elasticity of the skin and we improve the collagen.
So my collagen tunafaa kuanza kukula tukiwa 18.
If you're taking care of your skin when you're 18 and your skin is good, you don't need collagen.
No, okay.
You know the mistake that we do, we start taking care of our skin
now.
In 30s and 40s.
You have to take in good time.
Before.
Way before. Like for example, my kids now, they use sunscreen, everything.
Okay.
If it's finished, they send from school, Mom, come with this one today. So they know. So from our old age, from their age, now at 18, 20, their skin will be okay.
Okay.
But us, we never taught about our parents. That's why we suffered. Until we...
Sorry, Dome, and we literally have 3 minutes to say my goodbye. But I just have to ask this, because I've seen this on TikTok, on Instagram. Girls, very young girls, wanapakwa makeup. Wanaenda kwa shop, beauty store, and they buy makeup and they apply the skincare that we are talking about. They're doing all this. Is this safe or not?
It's safe so long as you're getting good guidance. Okay. It's safe. Okay. So long as they're given the type of makeup at their age what they could use. Again, going to a specialist but not prescribing which makeup or which skincare or which cream should I use. Yes. We treat teenagers actually a lot. A lot more acne. And from there we train them on how to take care of their skin. Even boys. Even boys, we train them. So long as there's a guide, it's okay. Right. It's okay.
Hey, sasa tunafaa kusema goodbye. Like literally 30 seconds for each of you before tunyolewe hewani. Yes, let's start with you, Karen, and then of course Mukali, having gone through this journey and now where you are at, and you know, what is it that you'd want people to know? And then we'll finish with Domiana.
So my part, aesthetics is not for ladies peke. Okay? So, I think gents have like that phobia that
now it has been changed. Now we want men who take care of themselves. So I mean, okay, all right.
For me, if you have a condition, it's not one treatment. It's a long journey. So you need to be patient and practice. Consistency is the key. So for me, it has worked and it will work for you.
And you remain consistent. Hey, patience. Patience. All right, Daviana.
For me, I would say it's working with professionals. I'm a skin esthetician, and at Skin Soul Aesthetic, we have professionals, we have a dermatologist, we have aesthetic doctor, and we work all together. The circle, the chain goes for us to give our patients the best results. So working with professionals have really helped me to learn so much as I go on, and also to help our clients to get the value of their money, because these treatments are not cheap. When you come, you will see. So I feel like we need to get the value of our money, and when we work with professionals and experience, and of course educating, going back to school, learning, then gives us best results, and it helps us give good results.
I
So
like that.
go to a professional and work with a chain of professionals.
So China is over the counter,
to China over the counter,
what influencers are doing, we need to stop.
Yeah,
we need to stop.
Sister. Stop. Don't do that. Work with professionals.
Yeah.
And I like the fact that Domiano, you pointed out and said, listen, so before we even talk about all these conditions and whatnot, it's important to take care of your skin.
Yes.
And your hair as well. From what you eat, from your lifestyle, to drink water. At the very
that's true.
That helps. That helps. Well, thank you so much, ladies and gentlemen, Edwin, for coming by today and educating us. Someone here says, very good show. I'm an ambassador for Skin Soul. My acne journey hasn't been easy, but I am grateful. So good job. You're doing good job. You're doing good job.
Thank you very much. Thank you.
Asanteni sana. Tuseme kwaheri, tumelan. When we said we are going to school, that is actually what happened.
Yes.
We went to school, we learned a lot. I hope you learned the same. Thank you so much for joining us today. Until tomorrow, my name is Mwikali. Kwaheri.
And my name is Winnie Lubembe. See you tomorrow. Bye.